Overview of the thyroid gland. The thyroid is a small butterfly-shaped gland located at the front of the neck, just beneath the skin. Part of the endocrine system, it plays a crucial role in regulating various essential bodily functions through the secretion of specific hormones. The thyroid's primary function is to manage your metabolic rate, the speed at which your body converts food into energy, a process necessary for the functioning of every cell in the body. When the thyroid does not function correctly, it can have widespread effects on your overall health. What does my thyroid do? So, function of the thyroid gland. As part of the endocrine system, the thyroid produces and releases specific hormones that regulate essential bodily functions. The main hormones produced by the thyroid include thyroxine, that is T4, the primary hormone made by the thyroid. T4 itself has minimal direct impact on metabolism, but once released into the bloodstream, it can be converted to T3 through deiodination, making it metabolically active. Triiodothyronine, that is T3, produced in smaller quantities than T4, T3 has a stronger effect on metabolism and significantly influences energy regulation. Reverse triiodothyronine RT3, produced in very small amounts, RT3 counteracts the effects of T3. Calcitonin. This hormone helps regulate blood calcium levels. So, to produce these hormones, the thyroid requires iodine as an essential element found in the body, especially in iodized salt and water. The thyroid absorbs iodine and uses it to create its hormones. Imbalances in iodine intake can affect hormone production. Thyroid hormones play a critical role in managing metabolism, heart rate, breathing, digestion, body temperature, brain development and mental function, skin and bone health, fertility. Let's see how other organs and glands interact with the thyroid. The thyroid operates within a complex network of glands and hormones known as the endocrine system, where glands often rely on signals from other hormones to function. The regulation of thyroid hormone levels is a coordinated process involving the brain and the thyroid itself. The hypothalamus in the brain releases thyroid releasing hormone, that is TRH, which signals the pituitary gland to act. In response, the pituitary gland produces thyroid stimulating hormone, that is TSH, which prompts the thyroid to release thyroxine T4 and triiodothyronine, that is T3, provided there is enough iodine available. The thyroid and its hormones influence several major organ systems. Cardiovascular system. Thyroid hormones regulate cardiac output, heart rate, and the force of the heart's contractions. Nervous system. Thyroid imbalances can lead to nervous system symptoms such as numbness, tingling, pain, and burning sensations. Hypothyroidism can cause depression, while hyperthyroidism can lead to anxiety. Digestive system. The thyroid impacts gastrointestinal motility, influencing how blood moves through the digestive tract. Reproductive system. Thyroid dysfunction can lead to irregular menstrual cycles and fertility challenges. In this way, the thyroid's activity has far reaching effects on many essential body functions. Now, the question is it possible to live without a thyroid? And the answer is yes. It is possible to live without a thyroid gland. However, lifelong hormone replacement medication is necessary to maintain health and prevent symptoms associated with thyroid hormone deficiency. Removal of the thyroid, a procedure known as thyroidectomy, is often performed to treat certain thyroid conditions. Let's see the location and structure of the thyroid. The thyroid gland is located at the front of the neck, wrapping around the windpipe. or trache, like a butterfly, with a narrower center and two wider wings extending to the sides of the throat. Normally, a healthy thyroid is neither visible nor palpable. Parts of the thyroid. The thyroid has two main sections, two lobes on each side of the neck, and a central part called the thyroid isthmus that connects them. It consists of two types of cells, thyroid follicle cells, means thyrocytes, which produce and store thyroid hormones, mainly T3 and T4. C cells, which release calcitonin, a hormone that helps regulate calcium levels in the blood. Size of the thyroid. Typically about 2 inches long, a healthy thyroid does not protrude. However, certain conditions can lead to an enlarged thyroid known as a goiter. Signs of a goiter include swelling in the front of the neck just below the Adam's apple, a sense of tightness in the throat, hoarseness or a scratchy voice. Thyroid conditions and disorders. Thyroid diseases can be classified as primary thyroid disease, originates in the thyroid gland. Secondary thyroid disease originates in the pituitary gland, which indirectly affects thyroid function. For example, excess thyroid hormones due to a thyroid nodule is primary hyperthyroidism, while a pituitary tumor causing an excess of thyroid stimulating hormone, that is TSH, is secondary hyperthyroidism. The four main thyroid conditions include: first is hypothyroidism, also known as underactive thyroid. Hypothyroidism is when your thyroid gland does not make and release enough hormone into your bloodstream. The condition slows down your metabolism, making you gain weight unexpectedly or feel tired all the time. Hormone replacement therapy is the most common treatment for an underactive thyroid. Hyperthyroidism or overactive thyroid. Hyperthyroidism, also called overactive thyroid, happens when your thyroid makes and releases high levels of thyroid hormone. It speeds up several bodily functions, causing symptoms like rapid heart rate, weight loss, increased appetite, and anxiety. Hyperthyroidism is treatable, typically with medications. Goiter or enlarged thyroid. Goiter happens when your thyroid gland grows larger. It has several possible causes and may or may not be associated with abnormal thyroid hormone levels. It's treatable. Thyroid cancer. Thyroid cancer is a growth of cells that starts in the thyroid, and the good news is that most thyroid cancers can be cured with treatment. Thyroid issues can manifest in various ways due to the gland's role in regulating heart rate, metabolism, and temperature. Commonly, early signs that may suggest a thyroid condition include a heart rate that is unusual slow or fast, unexplained weight gain or loss, sensitivity to cold or heat, feelings of depression or anxiety, irregular menstrual cycles. If you notice any of these symptoms, consider discussing thyroid function testing with your healthcare provider. How are thyroid conditions treated?